Morning, welcome. Welcome to everyone. Welcome to our second June SEB board meeting of the season. Our meeting this year will continue to be hybrid. HCA staff will be on site. Board members and other attendees have the option of attending on site or via Zoom. For our Zoom attendees, our opening slide is information on how attendees can turn on closed captioning subtitles. We're going to do roll call board intros. Pamela.
Good morning.
Donna.
Good morning.
Carrie.
Good morning.
Lyra.
Good morning.
Omid? Not yet. Allison?
Good morning.
Amy?
Good morning.
And Terry?
Good morning.
When you see Omid, let us know. We'll go ahead and recognize him. And also from the AG, Dana Giggler. Dana Giggler.
Good morning.
Virtual? Oh, there we go. Hey, Dana.
Hi.
Katie's in Honduras right now with her children. So she's on vacation, and so we have Dina today.
There we go. And I'm Lou McDermott. I'm the Deputy Director here at HCA and the Chair of the SEB Board. With board members attending both in person or virtually, it'd be helpful for board members to hold their questions until each presentation is done or when the presenter pauses and asks if there are questions. Board members attending virtually, we're also going to watch for your Zoom hand if you have a question. There's going to be no resolution scheduled for action today. The public will be able to provide general comments at the end of the meeting during the public comment period. As a reminder, the public has questions during the staff presentation. The presenter contact information is included. At the end of their presentation, the public is welcome to email the presenters during the meeting to capture the questions for a response after the meeting. Dave, what are we doing today?
Good morning, Chairman McDermott, members of the board. Today we are bringing to you the results of the annual procurement for renewals of plans. And so we have a presentation about the various benefit changes that are embodied within the rates that will then be presented later this morning. After all of that, we're not going to ask you to take any action. We're teeing all of this up for action on your July 10th meeting, which is anticipated to be the last board meeting of the season. And that is a Wednesday. Just I'm going to keep saying that because we don't want anybody to show up on the wrong day. You might show up at the PEB board meeting, but you don't get to vote at PEB. You can only vote on Wednesday the 10th at SEB. And then Jean, not John, is going to pinch hit for us. We thought it would be interesting to bring just kind of a review of how enrollment has looked in the portfolio since it launched. We're at about the 5-year mark, and just a good time to kind of look back and see trends. And so Jean will go through that for you. Then I will start talking about 2025's board meeting schedule, which we're getting ready to publish, and highlight some of the unique aspects of the schedule for next year, and then the meeting with public comment. I will say we do have that brief executive session at the start of the meeting just to address a couple of things. We closed the loop from the last executive session. Put 15 minutes on the agenda, not even sure it'll be 15 minutes. So members of the public, when you are in the waiting room, just encourage you to stay diligent. We might be back faster than 9:35. Oh, and if we have an emergency, we're going to walk purposefully across the street, not fast or slow, but purposefully to the parking lot, the visitor parking lot. And if you need the restroom, again, walk purposefully down the hallway. When you see the elevators, look left.
All right. You can tell we're getting into the end of board season. It's coming across. Any other questions for Dave? And I see Omid, you've joined us. Howdy, sir.
Hi, everyone.
We're going to approve the last board meeting, the minutes on June 6th. They're behind tab number 3. Are there any comments from the board? So funny.
There's a competition going on.
I see. No comments from the board. Do I have a motion to approve the minutes as written?
So moved to approve the minutes as written, Mrs. Myron.
Is there a second?
Second, Pam Cruz.
All right. All in favor, say aye.
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 Any opposed? Excellent. The June 6th, 2024 minutes are approved as written. Now we're going to be transitioning to executive session, which is going to happen here in Sue Crystal Room for board members and including HCA employees at this time, members of the public joining us in person at the Healthcare Authority today, as well as employees not part of the executive session, will be asked to wait in the main lobby for the duration of the executive session, which we're estimating about 15 minutes. You'll be called back to join us in Sue Crystal for the remainder of the public meeting. after executive session is concluded. So pursuant to RCW 42.30.110, subsection 1L, the board will now meet in executive session to consider proprietary or confidential non-published information related to the development, acquisition, or implementation of state purchased healthcare services as provided in RCW 4105.026. We definitely are the government. The executive session will conclude no later than 9:35. Board members, let's take a couple minutes while we transition into executive session.
Oh yeah, just say.
All right, we're back from executive session. We're waiting for our members from the public to rejoin us. They're in person. In person. Welcome back. All right, next up, Christine Davis, procurement manager in the ERP division, is going to be providing us with an update on annual procurement work with the carriers that helps inform benefit changes and ultimately next year's member monthly premiums. Materials behind tab number 4. Welcome.
Good morning, Chair McDermott, members of the board. I'm Christine Davis, procurement manager. Next slide, please. As mentioned, we will review the annual procurement, and as shown on screen is the annual renewal timeline, high level, starting with February, March, running through May to June, where we're at right now, to present this presentation along with the rates, and then July, pivoting towards voting. Next slide, please. Then overview the presentation. We're going to start with that IRS high deductible health plan update, followed by the carriers listed in alphabetical order: Kaiser Permanente of the Northwest, Kaiser Foundation Health Plan of Washington, Premier Blue Cross, and the Uniform Medical Plan. IRS high deductible health plan update. The IRS sets the inflation adjusted amounts for health savings accounts, and that is posted on the IRS's website. There's a link available, and the update for 2025 is that the individual annual deductible minimum is increasing by $50. So it will be $1,650 for an individual, and then the family will be $3,300. And this, for context, this board passed a resolution last year known as Resolution 2023-06, and it's available in the appendix for if you'd like to read it, but I will share it now for context in that for plan years beginning on or after January 1st, 2024, HCA shall set the annual deductible for a UMP high deductible health plan at the minimum annual deductible level established by the Internal Revenue Service IRS to qualify the plan as a high deductible health plan. Therefore, the agency will implement this change on behalf of the board, as indicated.
Just as a reminder, this is only for the UMP plan called UMP high deductible. That's this is all about the plan design that is required by the IRS in order for people to be able to take advantage of the tax savings, preferential tax savings associated with a health savings account. And so this is the only plan in the SEB portfolio that this applies to. I just appreciate the board setting we brought the resolution last year. We'll go through it more this year than we probably will in the future. Just to remind the board that the board set and gave the agency the authority to adjust the deductible so that we didn't have to review year after year for the rest of time a vote to raise deductibles. So just appreciate the context of what the board took last year. We said we would come back every year when there is an increase and tell the board what happened. And this is us telling you and reminding you of that context, and it'll be even more streamlined going forward. So we're just following the IRS rules at this point and chasing the floor.
So Kaiser Foundation Health Plan of the Northwest, the benefit changes. For this carrier, the changes are following state mandates. The first is House Bill 1979, reducing the cost of inhalers and epinephrine auto-injectors. starting with the 2025 plan year, caps the total out-of-pocket costs for a 30-day supply of at least one inhaled corticosteroid and one inhaled corticosteroid combination product at $35, and at least one epinephrine autoinjector product containing at least 2 autoinjectors at $35. The second mandate, Senate Bill 6127, increasing access to human immunodeficiency virus post-exposure prophylaxis, also known as PEP, drugs or therapies, starting with the 2025 plan year, prohibits health plans and Medicaid from imposing cost sharing or prior authorization requirements for at least one full PEP drug regime.
Real quick, this is a good pause, and just to orient members of the public that may not be familiar with this, Christine will go through, really there are 3 buckets, if you will, of types of changes in benefit design. There are state mandates, things that are required by the legislature under state law. You'll see another category as we move into Kaiser Washington, which is book of business changes. That's changes that they are making on a whole regional basis across their entire book of business, including the PEB and SEB portfolios where there are offerings, but not just the PEB and SEB portfolios. But that is kind of a regional change that is being made. And it's something that is offered up to the board as kind of the when the carriers bid something, they say, this is what we are offering you. And parts of that are mandatory, take it or leave it. It is, you are buying the product as is, and this is a change that is coming in the new as is product. The third bucket are kind of optional changes. So things that are offered up, not necessarily on the entire book of business by that carrier, but where there's discretion by the board as to whether to select something or not. And in those instances, we've talked about the incremental rate process in executive session. You haven't taken any action, but we bring you a final version embodying some of those optional changes in the rates that are brought to you today. So those are the 3 kind of categories: state mandates, book of business, regional changes, and then kind of discretionary benefit changes. So for Kaiser Northwest, the only changes for next year are the state mandates.
So with that context, Kaiser Foundation Health Plan of Washington benefit changes. This does include the Kaiser Foundation Health Plan of Washington options plans as well. And then I'm not going to read the slide in full like I did for Northwest, but Kaiser Washington is planning to follow state mandates House Bill 1979, reducing cost shares of inhalers and epinephrine autoinjectors, as well as Senate Bill 6127, increasing access to human immunodeficiency virus post-exposure prophylaxis, PEP drugs or therapies. And then the context that Dave shared just a moment ago, Kaiser Washington's book of business changes include removing the advanced care at home program. It was implemented in 2023, and members, as a result of this change, members will have access to services at home via their care providers as available. Plan cost shares, inpatient, outpatient, and pharmacy will apply based on the service provided. Followed by another book of business change related to end-stage renal disease, also known as ESRD. And individuals who have end-stage renal disease qualify for Medicare after a 90-day waiting period. Once an end-stage renal disease member becomes eligible for Medicare, Kaiser Washington may add coverage that would include waiving cost shares and reimbursing members for their cost of the standard Medicare Part B monthly premium.
And for members of the public on this one, this is really a strategy that a variety of carriers are using to leverage Medicare. Usually under federal law, you can't incentivize Medicare enrollment, but there's one exception to that, broad-based kind of exception that's an accepted practice, and it's this exact scenario to help people transition to coverage under Medicare and having or additional coverage related to end-stage renal disease. It's something that can help spread the cost of that care into Medicare long-term, but it's something that has a long on-ramp for being able to identify savings and plans, but it's a long game strategy.
Okay, and then on screen for those that are see it, Kaiser Washington Sound Choice Plan. This is specific to the plan that's noted on the slide. And so it's Kaiser Washington Sound Choice Plan Urgent Care Benefit. And if you can look at the column to the farthest to the right, network urgent care center or network provider's office for 2025. The deductible applies. Primary care copay is offered at $20. The specialty copay will remain at $30, and then a coinsurance at 15%.
One more piece of context on this one. Again, trying to remember how the public interacts with these benefit things. Some of this has been able to be shared in executive session, but catching everybody up. Last year, everyone's aware that there were significant increases in the Kaiser premiums, but there was also a lever that the board pulled last year, which was changing some of the benefit design to be more standardized with the book of business. The other way to say that is, for the first couple of years of SEB, there were features of Kaiser portfolio that were richer than generally exist either in the PEP portfolio or in other parts of Kaiser's book of business. And the board, to help kind of avoid even higher increases, pulled that lever to more standardize some of those aspects of the portfolio. This was one that was intended but didn't actually get implemented along with many of the pieces that were changing last year. So in some ways, this is just a cleanup of the final component of what was authorized by the board last year as part of that exercise to try to balance benefit design with premium increases that were happening.
Transitioning to Premier Blue Cross. Premier Blue Cross is intending to implement state mandates House Bill 1979, reducing the cost of inhalers and epinephrine auto-injectors, as well as Senate Bill 6127, increasing access to human immunodeficiency virus post-exposure prophylaxis (PEP) drugs for therapies. Premier Blue Cross is experiencing a service change related to the Premier High and Standard PPO plans. The Standard plan is exiting Jefferson County, and both the High and Standard plans are exiting Pelham and Mason counties. Members impacted by this change will have the option to select a different PPO plan, preferred provider organization plan, and a uniform medical plan such as Achieve 1, Achieve 2, or high deductible. Premier Blue Cross Health Maintenance Organization Plan, also known as HMO, is experiencing no change to the service area, and there are no book of business changes for medical or pharmacy for this carrier.
On the service area change, Primera is exiting those counties across the market. It's not just a retraction within this portfolio. They're not in the active employee PEP side of the equation, but elsewhere in the market, they have offerings. They are just fully exiting those counties. One good thing is we have 2 Blues plans in the state, and there's a lot of provider overlap. And so members that are in those plans in those counties should have a fairly easy transition into the uniform medical plan as the offerings that they have. So they all have those three plan offerings that they can choose from. And I believe it's somewhere around 2,000 to 2,100 members that are in those 3 counties that would be moving over into the UMP this fall. And as a reminder, we'll do a lot of outreach on this point to these members. And if they don't engage, they will be automatically enrolled in UMP Achieve 1.
Now we're transitioning to the uniform medical plan. Uniform medical plan is, as far as a federal mandate shared earlier in the presentation, is increasing the deductible to the high deductible plan. And following state mandates, House Bill 1979, reducing the cost of inhalers and epinephrine auto injectors, as well as Senate Bill 6127, increasing access to human immunodeficiency virus post-exposure prophylaxis (PEP) drugs for therapies. Then just a reminder, during this current board season on May the 2nd, 2024, the SEB board approved resolution 2024-08, UMP diagnostic and supplemental breast exam coverage. So beginning January 1st, 2025, diagnostic and supplemental breast exams are to be covered without member cost share to UMP members. UMP high deductible members need to meet their deductible before the plan will pay any portion of the claim. Then pertaining to the uniform medical Plus plan, Puget Sound High Value Network. There is a service area change within this plan. And Confluence Health is leaving the network as for 2025. As a result, the Puget Sound High Value Network is exiting the counties of Chelan and Douglas. Members impacted will have the option to select a different UP plan within the portfolio, known as Achieve 1, Achieve 2, or the High Deductible Plan. And this service area change impacts the subprograms approximately 331 for Chelan County and then 237 for Douglas County. In total, it impacts roughly 1,000 members between the 7 programs.
Good question. When you say the option of changing plans, what if they don't select anything? Are they defaulted?
Yeah, defaulted. The whole count is defaulted into Achieve 1.
Yeah, I just want to make sure they weren't going to get stuck.
Yes.
Yeah, as a broad policy measure, neither the PEB or SEB programs defaults people out and kicks people out of coverage. If a choice isn't made at some point along where they have to make a choice, they are put into coverage rather than put into waive status. That's just a broad policy position that both boards have endorsed as a kind of a fundamental tenet early on in the process. There are definitely members who get frustrated by that. They have part-time work and they're bouncing in and out of coverage or eligibility. But on the whole, the broad policy decision that was made long ago in PEB and similarly made in the early days of SEB policy making was defaulting people into coverage status of some sort.
Similar to what is shared with the service area change with Primera, there will be communications leading up to open enrollment surrounding this change to inform stakeholders and members so they may prepare. And then just for those that may not be as familiar with the Uniform Medical Plus plans, Puget Sound High Value Network, the service area for 2025, bringing that change, so to speak. So what would be available is King, Kitsap, Pierce, Snohomish, and Yakima counties. And then for the University of Washington Medicine Accountable Care Network, Benton, Franklin, King, Pierce, Skagit, Snohomish, Spokane, and Thurston counties will be available. And we don't anticipate further changes to the Uniform Medical Plus plans service areas. However, the networks do have until June 30th to notify the healthcare authority of any changes that would impact their service areas. And I welcome any questions.
Any questions from the board?
I will say, I just want to put an asterisk on my statement earlier that people would automatically be put in sheet 1. We have a lot of different moving parts of both programs. The typical default in the SEB program is Achieve 1, but there are times where you go, oh, actually the most comparable plan is Achieve 2. And so there, we described with the board in prior years that there is always this effort to map to the most similar plan possible. And so as I sat here, I was like, I think it is still Achieve 1, but we will definitely do the mapping exercise in each circumstance in each county and go, here is what is the most comparable to what people are in today so that they have something that is a similar experience. But absent any other kind of reason to vary, the general automatic enrollment policy is to put people into Achieve 1.
Thanks, Dave. Thanks, Christine.
Yeah.
Tanya Dool, Borough Finance Manager in FSD, is now going to introduce the SEB 2025 premiums that are going to go up for vote at our next meeting on July 10th. No action is scheduled on the resolutions today. Materials are behind tab number 5. Welcome, Tanya.
Thank you. Good morning, Chair McDermott, members of the board. For the record, my name is Tanya Dool, and I'll be briefing you on the 2025 proposed SEB premiums. So next slide, I believe Christine walked through this, but we're right in this blue box, June, where we're finalizing and presenting rates, where we'll ask for a vote at the next meeting. So no action today. So first up is just a refresher on how the employer medical contribution is determined and set. This is defined in the collective bargaining agreement, and we follow that methodology as described in that agreement. So the employer medical contribution, or known as the EMC, I'll call it, is the employer's contribution. So if we start with the UMP Achieve 2 bid rate at the top there, which has an illustrative example of $800. We multiply that by 85%, and that's the amount the state will contribute towards each of the medical plans. So when you subtract the $680 from the $800 total bid rate, the employee contribution is that difference of $120. We then follow that logic through each of the plans. So the plan bid rates can vary depending on the richness of the benefits. So in this example, we have a plan A of 800 through plan C of 725. So regardless of the cost of the total bid rate, the EMC remains the same at $680. So employees pay the difference between the bid rate and the EMC. So in a plan that costs a little more, like plan A, the employee contribution will be $120, whereas if they enroll in a plan that costs less, like plan C, they will pay $45. That then rolls through our tier ratios. So we have 4 different tiers that employees can enroll in. We have tier 1, which is just the subscriber, which is just times 1, the number itself. We then have a tier 2, which is a subscriber and spouse or state registered domestic partner, which is multiplied by 2. We have our tier 3, which is employee and child or children, regardless of the number of children on the account, it's multiplied by 1.75. And then tier 4, which is that subscriber employee, their spouse or state registered domestic partner, and their child or children, which is multiplied by 3. And it's the same for the employer contribution, the bid rate, and the employee contribution. So on this next slide here, we're going to look at the actual proposed 2025 bid rates, employer contribution, and then the employee contributions. So these are sorted by carriers. With the top, we have Kaiser Northwest, followed by Kaiser Washington Options, Primera, and then UMP, which with each of the plan offerings by carrier. The first set of numbers is the actual bid rate. The middle column is the employer contribution, which is $710 for plan year 25. So if you subtract that employer contribution from the bid rate, the far right column is the remaining employee contribution. As a reminder, the EMC for last year was $646, and this year it's increasing to $710. So on the next slide, I think is where we'll spend a little more time. So again, this is sorted in the same carrier and plan offering order. However, this focuses on the change in the subscriber-only employee premium from 2024 to 2025, and those first 2 blue columns, followed by the change in terms of dollars and percentages. And then as a reminder on the far right, we have some enrollment, so you can see the volume of enrollment in each of these plans. So you remember last year, like Dave mentioned, we did have some pretty difficult conversations with the board regarding Kaiser employee premiums and the increases that were experienced by employees for plan year 2024. You'll notice this year, there is a significant amount of plans on this slide here that we're actually going to experience a decrease in employee premiums. Well, all of the plans on this slide have actual bid rate increases year over year. What you're going to notice is that the benchmark plan, which is UMP Achieve 2, has an actual increase in employee contributions. And when the benchmark plan increases at a rate greater than the other plans, the employees will have a decrease because the employer is now picking up a bigger share of that total rate. So all of these plans had bid rate increases ranging from 0.5% up to 17% in bid rate, but the benchmark plan and the employer contribution is increasing by 9.9%. So in those plans where you're seeing a negative, that is because the rate of increase is less than the employer's contribution increase of 9.9%. I did want to note also, since we did have some difficult conversations regarding Kaiser last year, I did note that all of these plans do have bid rate increases, but I want to note that the Kaiser plans do have a better outlook on trend for their 2025 rate setting than they had in the 2024 experience. So that is positive. Their trend outlook is improving for the 2025 rate setting. Just going to let this sit for just a second.
While it's sitting, I just want to applaud Tanya and her team. People might not remember this, but this is the first time that they've identified a way to get it all on one slide. Usually in the past 5 years, you've had to flip between 2 slides to see the entire portfolio. And so a little bit of extra design work, got it all on one slide. And so just wanted to acknowledge that. It seems like a small thing, but it really helps you see the portfolio better when it's literally on one page.
So on the next slide here, we're just going to roll what we just walked through the tier ratios. So we were looking on the last slide at just the employee single subscriber tier. This just rolls them through all 4 tiers. So the same numbers just multiplied out by those tier ratios we walked through just a second ago. And this is the last slide on employee contributions. So I want to pause here for any questions. On medical. Okay, still time for questions, but we'll move on. So next up is the life and AD&D, and this is here because there is an employee portion, but this is just to note that the basic life and AD&D and employer paid LTD is 100% employer funded, but there is supplemental life and accidental death and dismemberment, as well as employee paid LTD that employees can purchase. And we just wanted to note that there are no changes in those rates for 2025. Vision and dental are 100% employer paid, so those do not need rates to go in front of the board.
Tanya, do you know the last time there was any increase in the life and LTD employee paid premiums?
I think you're setting me up because you know.
Yep.
You can take that one.
There has never been an increase on the life insurance supplemental employee paid. We started off with a rate guarantee, and then we have another multi-year rate guarantee. So there won't be for several more years. I can follow up with the number of years. I'm afraid to say the wrong number, but we have never experienced a rate increase on the employee paid supplemental life insurance, or the employee paid life insurance. On the LTD, I actually am not sure, but there has not been, and the answer is the same for at least the SEB portfolio. We have not seen increases in the employee paid portion of either of those benefits at this point.
So next up there are the proposed resolutions that we'll ask the board to take action on at the next board meeting. I want to note that how the resolutions work is they're set by carrier. So by the board authorizing a carrier resolution, it will adopt all of the premiums as well as the underlying benefit design and those changes that Christine just described when the board authorizes a carrier resolution. And you'll notice I said authorize because we changed that based on last year's feedback. So how these are structured, I will not read them all, but we'll walk through the first one. It's just, so you'll see this is Kaiser Northwest. So the SEB board authorizes the Kaiser Foundation Health Plan of the Northwest 2025 employee premiums. And this resolution language repeats itself for each of the carriers. So we have one then for Kaiser Washington Options, Primera, and the Uniform Medical Plan. So I will be back at the July 10th meeting to ask the board to take action.
One more reminder, because it's a perennial question that comes up is, it is designed on a carrier-wide vote, not plan by plan. Think of it as each carrier, it's a suite of benefits and it's a bundle of sticks that are all together. And there are some aspects of it that are kind of interrelated from enrollment assumptions, switching assumptions. You can't, unfortunately, snipe an individual plan out. The question really is the suite of offerings carrier by carrier. And so that's why we tee it up as a singular vote in that way, because it would fundamentally impact the rate setting process to eliminate a singular plan from the equation at this point in the process. If there is concern about a particular plan, then I'd ask you to kind of raise that concern so that it gets on our radar to work on in the next rate setting process. But at this point in the process, it's kind of an up or down vote on the entire carrier's bundle of sticks, if you will.
Any questions for Tanya or Dave? All right.
Well, thank you guys.
Tanya, thank you.
A lot better than last year.
There we go. Yeah. All right, next up, Jean Bowie, pinch hitting for John Pardon, our benefit strategy, Jean, our deputy director.
He's only pinch hitting the presentation, yes. Not his job.
Okay. Jean Bowie, the deputy director in the IRB division, is presenting a look back at some enrollment trends and insights over the years. Since the program's launch in 2020, materials are on tab number 6. I encourage the board to ask questions.
Nice.
follow-up. Good morning, Chair McDermott and members of the board. I am Jean Bowie, our Deputy Director, filling in for John today. And it's hard to believe, but we are midway through our 5th year of the SEB program. I know, it's crazy. And so we thought it would be pretty interesting to the board for us to take a look back over those 5 years and review some of the enrollment patterns and changes that have occurred since the program's inception.
And Dave, just from memory, what is the first SEB board meeting we actually had?
The first SEB board meeting was actually in September of 2017. And then the program first inaugural open enrollment was the fall of 2019 for plans that began January 1st, 2020. And then we had a pandemic that started.
Yay.
Slide, please. So the next 2 slides, we will show you the historic enrollment by member type. And as you'll see, we've seen consistent growth each year. During plan year 2021, pandemic year, we did see a dip in subscriber enrollment, although the overall program enrollment was higher than the previous year. We believe this was related to the legislation regarding dual enrollment and some of the impacts of COVID-19.
I will add one more thing to remember that's just kind of, there's always going to be a little asterisk in my mind around 2021 as from an eligibility standpoint. The legislature kind of had frozen eligibility during the pandemic in the SEB program so that people who were not able to go into a physical space as things were changing and hours were changing. There was a freeze where if you were in benefits for a time period, you couldn't be dropped from them. You know, it's that kind of phenomenon that we have in an employer-based health insurance setting that if you lose your job, you often lose your insurance at the same time. But that was kind of, there was a fix temporarily by the legislature, specifically in the SEB program. And so we would have seen possibly even greater losses in the subscriber count if that freezing hadn't been put in place for a period of time. So just there was a little bit of loss there in that particular year, but without that freeze, it could have been, these numbers that year might have been a lot different for everybody.
The classified world thanks you for that.
I'm just glad the legislature thought to ask if there was anything else to add into that bill, because as we all know, things were moving very fast in 2020 and that freeze was put in place in the last couple of days of session and one of the final bills as the legislature was putting together kind of its initial response to try to address a variety of issues in our world. And SEB eligibility made it into that bill, and glad that everyone thought about that.
Next slide, please. This slide is a comparison of subscribers who waive medical versus enroll in SEB medical coverage. And as you can see, the number of subscribers waiving has remained pretty stable over the entire time period. The next few slides provide some insight into the enrollment patterns within the SEB carriers. The biggest news here is the large increase in enrollment in the uniform medical plans. Both UMP and Primera have increased enrollment over the last 5 years, with both KPWA and KP Northwest decreasing. This slide gives you a view of that with the uniform medical plan. We are almost at half of the portfolio at 47%. So we're getting a lot of growth in those plans.
I used to say as the program launched that the plurality, and made people look up what plurality meant as a concept, was in the uniform medical plan. It was about a third of the portfolio. And so over the past 5 years, we're almost to the point where it's a simple majority, which is the case.
We have a view of the plans selected by deductible. Overall, the selection of deductibles has been pretty stable between 2021 and this year, 2024. We have seen a shift into UMP Achieve 2, which has one of the lower deductibles at $250. We've also seen more enrollment in the UMP high deductible plan, especially during plan year open enrollment for plan year 24. So this is one of my very favorite slides. It is our new retirees by month and a comparison between the both the PEB and SEB programs. And as you can see, there are some definite spikes in the months of retirement for SEB, with the PEB pattern being a little flatter. With SEB, the beginning and the end of the school years are when we see our surges in new retirees, and probably no surprise to our folks in this room. And just for your information, these numbers do reflect both our Medicare and our non-Medicare new retirees. So, are there any questions for me?
I will highlight in the appendix, you will see a drill down into each carrier suites of plans, and you can see the bar graphs of that whole of enrollment plan by plan. So that's just kind of a drill down. We presented the macro carrier piece, but there is information in the appendix if you wanted to dive into the individual plan year over year. Donna.
For someone who's in that process right now, we have the spikes in July, and then we have the spikes in September. Insurance has a lot to do with that. So I'm glad I have my SEB through the end of the summer instead of choosing to retire in July. But people retire in July because then they get the cost of living increase the next year. That's why you see those spikes. It's pretty cool.
Jane, do we have also data on people's satisfaction with the various plans?
We do. We have the CAPS surveys that come out later in the year. So they come out towards the latter part of the summer for the previous year.
It'd be interesting in future board meetings just to correlate, what we see in the movement with general satisfaction with the plans.
Yeah, that's a great call.
Any other questions for Jean? Sorry, Dave, I know that was unscripted. Dave's like, just keep piling it on.
Next year.
Next year. Other questions? Jean, thank you for mentioning today. All right, next up, Dave's going to go over the meeting schedule for 2025. This 2024 is halfway done, so let's get into 25.
We like to give board members and the public as much advance notice for the open public. We shine in our open public meeting compliance with regards to filing of our schedule way in advance. So a couple of features to highlight about this particular schedule for next year. It's not published yet. What we always do is we form a schedule, bring it to you at one meeting, and then we go through the filing process and bring you the final schedule at the last board meeting of the season. So you'll notice this year the retreat goes back to a little earlier in January. This year was at the very end of January. Some of it's just the way New Year's falls and the various dates. I'm confident as educators, all of you are aware that the calendar changes every year, and that there's a lot of quirks that can happen year over year. But we are back to a little bit earlier in the January season. Next year, one of the factors that I always am thinking about and helping navigate for board meetings is what the likely legislative calendar for the next session looks like compared to board meeting schedules. Can't make it perfect, and it's an art, not a science, because the rules can change every year as to how long policy and cutoffs are, et cetera. But next year is a long session, and we do know that the legislative session ends, I believe it's April 27th. Again, the way the calendar falls, it ends really late. It's among the latest days that it can possibly end. And that brings us to, in March this year, if it feels like the meeting's earlier, it is, because last year we would have had a board meeting on the last day of the legislative session, or in the 2024 year, and that just isn't a good opportunity for anyone to be successful at the agency as we try to navigate any last minute things that the legislature is asking. Sometimes there's no questions and there's no hustle and bustle, and other times it's fast and furious. So I had frame shifted the meeting out this year. So we're back to the general rule is the first Thursday of the month is SEB. So you see that experience again. But as you go down to May, you'll be like, it can't be the first Thursday of the month, Dave. With the end of legislative session, the week of May 1st, and the way that our rate process works, we have initial rates due on May 1st. Again, we noticed this year that there was less opportunity to be successful and give the board any preliminary information on rates that were received that day. So frame shifted that out a week. So if that feels a little bit later, it's to try to be a little bit more responsive to give you information about how session ended and how the initial rates pieces came in as we have an executive session. When we hit June, I want to draw attention that June 18th is not a Thursday. Mark that on your calendars. It's a Wednesday, because Juneteenth next year is a Thursday. So it's state holiday. We will not be having a board meeting on a state holiday. It will be frame shifted to the day before, Wednesday the 18th. And then in July, again, you see 4 meetings. We overscheduled July. We never quite know how rate setting season is going to go this year. We're fortunate that we anticipate that we're going to end the board season the earliest that we've ended it for SEB, which is July 10th. And then we will ultimately cancel the subsequent meetings. But here, historically, we've had to use at least 2 meetings in July. We're never sure exactly how it's going to go. So you can anticipate, and I would ask you to hold those dates until we know how things are going in May of June next year. So again, we overschedule because it's easier to schedule things in advance for a regular meeting under the Public Meetings Act. And we want to get everything on everyone's calendar. I do not anticipate that we would all be together 4 times in July. Also want to highlight that once we move to July, SEB board meetings transition to Wednesdays. We end up having back-to-back board meetings, SEB on Wednesdays, PEB on Thursdays. We try to keep SEB consistent. We have a lot of retirees that attend our board meetings, and we just want to make sure that shifting to a different day doesn't lose them the opportunity to have a predictable schedule to be part of the board meetings. So we keep PEB on the Thursday track, and we frame shift this board over to Wednesdays, which is my reminder that our next board meeting is a Wednesday, not a Thursday. So a little bit of calendar fun.
Questions for Dave? All right, we're up to public comment. Is there anyone on Zoom that would like to provide public comment? If you do, please put your Zoom hand up. Anyone in the room? All righty.
We don't have any hands yet.
We'll give it another few. So folks, if you would like to make public comment, please put your Zoom hand up and we will track you. All right, seeing none. Our next meeting is going to be July 10th, starting at 9 a.m. with the same format. In attendance, you can be in person or via Zoom. Dave, any final comments before we adjourn?
So next board meeting, we'll bring you the resolution that Tanya teed up. We will have Alyssa, who oversees the customer service operations teams, talk about the transition as we prepare for open enrollment. We always do a preview of coming attractions there. We will have Ellen Wolfhagen, who's done a couple of presentations for the board, just give you an update on where things are on the Medicare portfolio for the PEB program. Again, almost everyone retires and eventually can come over to the PEB program. We all want to retire, and so just wanted to talk a little bit about some of the bigger changes that are happening on the PEB side as I always say, as K-12 graduates in PEB, just a little tongue-in-cheek humor for the school piece. And then we will have a presentation about the PEB-SEB consolidation report. We're anticipating that we're going to be doing kind of a stakeholder process around that report from mid-July to mid-August, and we're kicking it off by having a presentation to each of the boards on the 10th and 11th about where we are, how we're approaching different parts of the topics within that report. So we anticipate having that conversation with the board on the 10th. As a reminder, that report is due to the legislature December 1st. So I'll ask you to kind of read through those materials. It'll be your key opportunity to chime in on things that you want us to be kind of factoring in and thinking about on the various topics that are charged for that report. And so that's also the board's stakeholder process, if you will. well. So we're kicking off stakeholdering with board stakeholdering with a consolidation report update. That's next.
Any questions?
Not next week. That's the 10th.
All right. Well, Dave, I just wanted to compliment you and your staff on what an amazing job you guys during board season and board members for the ongoing attendance that we've had times in different boards where it hasn't gone as smoothly or as well. And hybrid meetings are always hard, and your staff always make it look easy. It's not easy. It's actually a nightmare. So really appreciate all that work that goes into it. And this meeting's adjourned. Thank you.